Right. Good morning, everyone. Thank you so much for joining today's webinar. So I think we have got people who have joined it. So let's make a start. Right. So today's webinar is about the PLAB journey, and we're going to discuss about what are the obstacles, what are the worries, and what are other issues which we could address to make your journey pleasant and very smooth. This is about me. I'm one of you guys, international medical graduate. I went through the PLAB journey, completed my journey from junior doctor to consultant after spending 20 years in NHS, then decided to support and facilitate other junior doctors to make their PLAB journey smooth and easy. We have got Dr. Umar with us, who is co-founder and our academic lead. He also brings 20 years of clinical and academic experience, and he's looking after our academic side. During the PLAB journey, there are so many things which are main obstacles, main worries, apart from passing the exam. Because I believe once you have passed your MBBS exam, after that, PLAB is not hard, but lots of other things which are very important to address and highlight. And we believe Hive Medical Academy is here to address all those concerns and to support you and to make your journey very pleasant and very successful. So these are the some concerns and some issues and some worries or some obstacles we are going to address here. But please feel free to add your further concerns or worries or obstacles which are stopping you to start this journey, and we will here to help you. Of course, is the one of thing is the financial pressure of exams. Exams are not very cheap. PLAB exam fee, English exam fee. Then about the visa requirements, you're moving to different country. What's the visa application process, what are the required documents, and what about if your visa is rejected. Then other thing is the balancing work, study, and personal life. Most of the doctors after graduation, they will be working in their country in different hospitals, different shifts. Either they're in PG training, postgraduate training system, or they're just working as MO. Obviously, they are doing something. So how they're going to balance it, how going to get the time to prepare for their PLAB exam. And most importantly, when you're moving to a different country, it's completely different culture, different environment, different people, different system. And what are the things which you need to know, which you need to learn to adopt best in your new culture, new country? Uh, Again, it's other thing is, it's not just passing the PLAB exam, it's more than passing the exam. We need to understand that how we're going to settle into NHS, or what are the training system, what are the things which will help you in NHS system. Just few people they do ask about, what sort of the environment is. Are we going to work 36 hours, 12 hours? Are we going to, because in different countries they have got a different working system, emergency duties and others. So we are going to give you a very good view of overview of all these things. Right. Then again, you need to think about, when you're taking a new exam, it's completely different exam as compared to in your country. You will have some fear that if what about if I fail my exam once, who is going to help me? Because it will be very expensive to pay again for the exam. Uncertainty about the job. What about if I have passed my exam and am I going to get the job? Is it a guarantee that I will get the job? How I'm going to get the clinical attachment? Is UK culture going to accept me? I'm overseas international medical graduate. There will be local graduates. So is the racism there? How I'm going to manage? How I'm going to cope there? Right. Then another big topic about is it's about limited guidance about the structure of the exam and preparation resources. There are quite few myths about what sort of resources I should use and what will help me to prepare my exam better. Do you still see my screen?
Yes, we can see you. It was running fine. Presentation was
All right.
fine also.
I think something was echoing. Sorry about that. So again, limited guidance about the exam, the structure of the exam, format of the exam, how we're going to manage it, what are the resources? Because these days there are so many resources available on the internet. But you need to consider that are they credible? Are they going to help us? Are they going to make our journey very pleasant? Are they going to hold our hand from the day one till we finish our PLAB exam, till we get the job, and we settle down? And the other thing is that, if I've got past my PLAB one, I need to move to the UK. I'm going to apply for the job, and what will be the process? Who is going to book my accommodation? How I'm going to stay there, and how much it will cost? So all these things, these are the very genuine and very important issues which we need to address, and we are here to help you. Right. Other myth is about that, PLAB is, we think that PLAB is an easy exam. Yeah, it is easy, but as far as you have got the professional guidance, you have got the professional support, and you have the people who are in the system, who have been in the system for many, many years, and who could help you, who could guide you. But if you get the guidance from the people who don't know the UK system, who don't know the training system, who have not got any experience about the UK training system, they're not going to guide you properly because they don't know themselves. So the right people, right resources, that will make your journey very pleasant and very smooth. Again, another thing which I mentioned before, passing the PLAB is just like you passing another exam. The most important hurdle, most important thing starts after you have passed your PLAB, because after that you need to know, you need to understand the UK NHS system, health system, how going to work and how you're going to adjust yourself in that. For that you need the clinical attachments, you need the local CPD courses, you need the NHS induction. And so passing PLAB is just a one step, and after that is the next journey starts, and Hive will stand with you and we will address these things and we will support you to make sure you get the job. Again, it's a limited mentorship and guidance for international medical graduates. This is unfortunately same like 20 years before or 25 years before when I did my PLAB. We have very limited support and guidance. And still, unfortunately, it's the same issue. Majority of international medical graduates, they have got very limited support, a very limited professional guidance, and that's why they struggle. And sometimes, some of the immigrants, international medical graduates, they have got full plan. They are ready to take plan, but these hurdles, they stop them. They change their plan that, oh no, it is hard, so I should go to a different way. I should go to Middle East. I should go to different country because they don't have the proper guidance and proper support. And some of the doctors who have got some gap in their career, especially female doctors who have been, off work for some reasons, got married, they have got maternity leave, they have got children, they could not work. There's a gap, and some they feel that, oh, if they have got gap in their career, clinical career, they can't take PLAB exam. This is again is a wrong perception. It is not like that, and this is how we want to address all these concerns. Again, I would request, everybody, if you have got any more concerns, please just write down in the chat box and we will address all those concerns. Right, how High Medical Academy will support you guys and international medical graduates. So as I said, I am one of you guys. And I would say if I have done it, you can do it better. Because when I did it, we have very limited resources. I didn't have Hive there to hold my hand from the day one until then. But you guys are lucky. You are the fortunate people. You have got so many resources. And Hive is there for you to hold your hand from the day one to make your this journey very successful, very clear, and very proud of you, proud moment for you. And we say that, we are not just going to help you to pass your exam. What we do, we give you the holistic care, where we look after your clinical career, your medical career, your practical career, and we look after your mental health well-being as well, which is very important because you are stress-free, you are well, You will focus more on your growth. You will focus more on your exams. You will pass your exams, and you will adjust very easily in the new system, new career pathway, new training system. Please feel free. These are our success stories. We have got a lot of medical graduates from the previous years who had been with us, and they made their journey very successful. They're working. Some of the doctors they're working as SHO. Some of them are consultant now. Some are just training systems. So feel free to have these links and to read the success stories of the doctors, international medical graduates who are like us, who are like me, and they made this journey very successful. And Hive proudly stood with them from day one. We proud to say that we made this journey very stress-free. We asked them, just you focus on your exams and rest let us do everything. Right. If I summarize everything, we say if somebody wants to international medical graduate, if it was me now, and if I want to plan to start a new journey in the UK for the new NHS, so most important concern would be, yeah, understanding what will be the PLAB exam, what is the PLAB, right? How is it going to work for me, and then I would say what will be the cost, how much it will cost. Is going to be a big financial strain for me? What will be the visa and immigration costs, how I'm going to manage time. Because if I'm working as well at the moment, I'm a trainee, I'm a PG training, so how is going to help me, how I'm going to manage time, how I is going to make a difference in this. And UK culture is, I heard some of the doctors say that international medical say, oh, UK is very racist. How I'm going to adjust in NHS. So these are the myths. It is not like that. UK is not a racist. UK is one of the multicultural country where everybody adjusts very well. And as I said, if I have done it, I have completed this journey from day one, from junior doctor to consultant, made it very successful. You guys could do it as far as we are standing with you to make your journey very pleasant. Again, about is some curious because majority of international medical graduates, English is not our first language. So we do worry about because we know we study in English, but we practice in different languages, either in Urdu, Hindi, or whatever the language we do it. But don't worry about we don't make this barrier stop your dreams. If you have got struggle this one, we will help you to pass your English test. We are here to support you to pass your exam. Then emotional psychology, we will stand with you from the day one, in every up and down in this journey to make it a success for you. There are few other quiz like people think that, oh, if even I pass my English test, if I prepare for my PLAB one, I'm not going to get the seat. That's again, it's not true. We are here, we will help you, we'll guide you how you can book your seat, and we will fully support you to book your exam, get your exam done, and move to the UK. Meeting eligibility criteria, some doctors still think that am I eligible or not? If you're not, then we will give you complete clearance about it that yes, you can do the PLAB. I will mention in a few in further slides that yes, yeah, you can do it. What is the clear eligibility criteria for the PLAB exam? Right, there are a few more things. Right, when should I apply? How should I prepare the exams? What resources would I need? Should I join an academy to do it alone? How am I going to get a visa for the PLAB? Where will I book my ticket from? Where will I live? How will I commute to and from the academy, and how I'm going to manage all these things, and how I'm going to adjust in NHS. So as I said, these are just a few concerns which we have noticed and we want you to address. But guys, please feel free to just highlight all your concerns here so that we could address all your concerns. So we believe that nothing should stop you from making your dreams true. International medical graduates can have a better career, better training, and better future for themselves, for their families. So it is only important when you take steps. And you have got the professional guidance and support with you who are guiding you at each step. Right. So next, as I said, we're going to talk about PLAB journey of international medical graduate. How it's going to work the PLAB journey. I think there is some. Right. So there is something gone wrong with my slide. Right. So let's move to the PLAB journey. It's Right. So what you need to start working as a doctor in the UK. So you need to be a medical graduate from any recognized medical university from anywhere in the world. Pass either IELTS or OET test. Pass your UKMLA a PLAB 1 exam. Pass your UKMLA PLAB 2. You need clinical attachment, get the GMC registration, and start working as a doctor in the UK. These are the only requirements for you to be eligible to work in the UK as a doctor, registered doctor. There's nothing else requirement. Like most of the doctors, they ask, oh, do we need a 6 month, 12-month house job? Do we need to have 4 month rotation in each specialty? Do we need to have this one? So guys, just notice these are the only requirement for you to become a registered doctor in the UK. Be a medical graduate from any recognized GMC recognized university from the world. Pass your either IELTS or OET exam. Pass your UKMLA PLAB 1. Pass your UKMLA PLAB 2 exam. Clinical attachment, and you'll get the GMC registration. Start working as a doctor. Right, this is how it will be your journey. Right, from day one to end, you pass exams, PLAB 1, PLAB 2, get ready for NHS, and start your beautiful career and successful career in the UK. How long it will take your entire journey? Your PLAB journey will take 9 to 12 months. If you start today, it will take you 9 to 12 months to pass all your exams and start working as a doctor. This is IELTS and OET, it will take you 1 to 2 months. And the PLAB 1 preparation, if you're using resources like our Hive Medical Academy resources, will make sure you pass your exam 3 to 4 months, and then PLAB 2, including your travel and accommodation, 2 to 3 months, and post PLAB 1 to 2 months after passing your PLAB, where you'll do your clinical attachment, will prepare you for your mock interviews and other things, and you will get a job in the NHS. Briefly, I want to mention about the training system. PG training, which is postgraduate training, it has got the different names in different countries. In some countries, it says the PG training, and most of the countries, it is not paid. But the UK training system, it is completely different. UK, you have got foundation program, then you have got ST training program and GPST training program. So I will explain briefly about all these things. Anybody who has done the MBBS and they are fresh graduates, they have passed their PLAB, they're coming to the UK, and these are the training systems. They will apply to them and they could join or enroll in these systems to become a consultant, or you become a general practitioner. So foundation program is FI1 and FI2. All the fresh medical graduates from the UK and international medical graduates, they are eligible to apply for the foundation program as far as they have got a degree recognized from the recognized university. Foundation year one is the PRHO, pre-registration house officer, which was previously it was used to call. So in foundation year one, what you do, you have got 3 rotation, 4 months of each in different specialties, and then you move to your foundation year two. In foundation year two, you have 4 month rotation of another 3 specialties. So in 2 years, you have 6 specialties, 4 month rotation in each. The idea of this just to give you taste of all these specialties. When you're in final year medical student, you think, oh, I want to become a surgeon, I want to become a physician. No, I have got interest in orthopedic. But when you do foundation program where you experience yourself, you spend time there, that will give you better idea what you like. After completing foundation year, you will be in far better position to decide what are your likings, what you want to be. You want to be a physician? You want to be a surgeon, you want to be a plastic surgeon, you want to be orthopedic surgeon, or you want to become a psychiatrist. So these are very good program because it give you awareness, exposure, and make you think about what you like it, what you want to see yourself in future. What happens in foundation years, you will have two supervisors. You will have one educational supervisor and one clinical supervisor, and you have got e-portfolio, electronic portfolio, where you will be completing your daily routines like CBDs, your orders, and your mini cases, your multi-source feedback, and your clinical supervisor, education supervisors will be helping you to complete your training successfully. You'll have regularly discussion sessions with your supervisors where you'll be reviewing your practice, what you're doing, what you're learning, what are your learning points, and what you need, what are your weaknesses, what you need to learn more. So this is the foundation program which all the international medical graduates, after they have done the degree, they are eligible to apply. And local medical graduates, UK graduates, they start their foundation program after their degree. Please feel free to put any questions if you have got. I'm more than happy to answer about these things because there are lots of misconceptions, myths about the training system. Some people they say this is the PG training, but in the UK the training system does not call the PG training. It's called Foundation Program, Specialty Training Program, and GPST or GP Specialty Training Program. So just to clarify things that PG training is different, but in the UK not. If you're coming to the UK, remember your training system, all three, Foundation Program, GPST, and ST Training Program. Right. Now we come to the UK specialty. As I said, that was the foundation. Once you have done your foundation, after, obviously, you will have exposure to six different specialties. After that, you have choice where you want to go. Either you like to go into primary care, you want to become a general practitioner. That will give you, you need to apply for GPST training program. That's the 3 year training. You will apply. And during these 3 years, you will have 2 years, 6 months rotation or 4 months rotation, different specialties in hospital. 1 year rotation you will have in GP surgery in primary care. Again, in this training, you will have your education supervisors, you will have your clinical supervisor. They will be closely assessing your progress. They will be helping you to make sure you are progressing to a next step of your training. And during your these 3 years, you have to pass two exams. MRCGP Part 1, which is called AKT, and MRCGP Part 2, which is called SCA, SESA, these two exams. So once you have passed these two exams during your 3 years, you will become a certified GP register as a GP, and you can work as an independent general practitioner in the UK. So that's the GP training. Summarize it, 3 years after training, 2 years rotations you will in hospital, any teaching hospital foundation trust. 1 year you will be spending in your GP training with the GPs, supervisors, GP, your educational or clinical supervisor who will help you. Two exams you need to pass for the GP, GP, MRC GP Part 1, which is AKT, MRC GP Part 2, CSA or SCA, this is a new name. But if you want to become a consultant, hospital consultant, there's a different route. Then you need to apply for specialty training. Specialty training are announced nationwide from the deaneries every year. And once you have completed your foundation program, you are eligible to apply for your training. If you want to apply for the medicine or you want to become a surgeon, you want to become an orthopedic surgeon, you want to go into psychiatry, accordingly, you need to apply in that specialty for the training. ST training is slightly different from foundation and GP training. GP training is only 3 years. ST training is 5 to 7 years because you start from ST1 to ST5, 6, and 7, and then after that you become consultant. And during these 5 years, again, you will have clinical supervisor, you will have educational supervisor, and you need to clear exams of that specialty. If you are in medicine, you will be completing your MRCP Part 1, then you will be completing MRC Part 2, and finally the PACES you have to complete. And once you have completed all your exams, and you need to do your CCT, Certificate of Completion of Training, awarded, and then you become a consultant in the UK. So to summarize, specialty training, choose the specialty you want to apply. If you want to go on medicine, surgery, apply to that nationwide vacancies open, training schemes open, and you start from ST1, then you'll go up to ST7, pass your exams, and you become a consultant, start working as a consultant in the UK. Very simple and very straightforward. Again, guys, don't mix up PG training and UK training system. There is a confusion. So remember, in the UK, the training system does not call the PG training. It is called foundation program. Then you have got ST training, and then you have got GP training. But as I said, our ultimate goal is make sure you pass your exam. We make your journey very pleasant and successful and get you what you want. We will help you to achieve your dreams. Whatever your dreams, you want to become a consultant, you want to become a GP, or you want to become a successful. One more thing I will mention, if somebody doesn't want to go to training, some doctors they ask the question, oh, I don't want to go to training. I have done, I'm international medical graduate, and I want to just want easy route. So yes, there is a way to that as well. If you don't want to apply for the training programs, GPST or STs, then you apply for the locum training post, which these are called non-training posts, locum post. Either you become apply for the SHO, and after SHO, you can apply for the staff grade post. Staff grade and locum SHO post, these are the non-training posts, but still you could do your exams, you could go through your revalidation, you will go through your appraisal, you will still have a supervisor, the consultant in the ward, consultant of the department will be your supervisor. He will be looking after you, he will be guiding you. And if you want to stay just a staff grade, if you want to become an associate specialist, and then you after a few years of experience, 5 to 6 years of experience, you can even work as a locum consultant. So the training post is not the only solution. If somebody international medical graduate, they don't want to go into training, still there are plenty of jobs who can apply and they could secure a job in the NHS. Right. As I said, being spending 20 years in NHS, enjoy the benefits as well, and you guys could enjoy all these benefits in NHS as well. NHS is world-class service provider and one of the best healthcare system in the world. So benefits, you will get the paid leave, almost 41 days paid leave, holidays, and you can, get easily get mortgage, you can get a house. It will make much easier. You can get a car, brand new car, NHS discounts applies. You have got very much flexible working life, family and work life. There's a very good balance in this one. And you have got multiple options as well. You want to go part time, you want to work full time, you want to work only few days a week, you want to become a GP and you said, okay, you want to work one day a week. So this is very flexible. It gives you multiple options. You can arrange according to your life, and you have got beautiful combination of work and family life balance where you enjoy your life as well. It's not just you become work, work, and work. No, you have got the balance, and this boosts your mental health and your family and social life as well. As I said, UK is a multicultural society, and you have got so many uh, people from every culture where you could mix up, you could have socialization, you can enjoy your life far better than any other country. Then shopping, you have got lots of discounts on the shoppings. If you're getting car insurance, house insurance, if you're doing daily grocery shopping, so you still get the discount on that if you are an NHS employee. Right. Briefly, say that, it's all these are the hurdles and what are the benefits I mentioned. But whatever we addressed, if these are the basic hurdles, these are the basic obstacles, or these are your worries which are stopping you to make your dreams true, stop worrying about it. We are here. We will hold your hand from day one. We'll take all your worries away. This is one thing we assure you, that we'll take all your worries away. We'll make your journey very successful. And simply, I said, if I'm one of you guys. If I have done it, you can do it very easily, far better than me. Just you need that push, you need that guidance, you need that support from us, and we are here today to help you and guide you. These are the some services and what we offer and how we have been supporting our doctors from international medical graduates who are coming here and making the journey very successful. And as we say, you guys just need to focus on your study. Just focus on your study. Let us do rest everything for you, and we'll make this journey very pleasant and very successful. So you will feel proud and you will achieve your dreams. Never let anything, any worry stop your dreams. Right, that's it about my presentations, and I think we have got Dr. Omar, who is very patiently waiting now. Dr. Omar is our academic lead. He brings almost 20 years of experience in NHS. Teaching is his passion, and he has been teaching nurses, junior doctors, pharmacists. He has been a mentor, he has been a trainer, and people love his teaching style. So I will just pass over to Dr. Umar now to start telling you about what else we could do it. And then again, I will mention that we have got Dr. Muhammad Yunus Parvaz. He is our senior executive member. He is himself is an international medical graduate, and he has got his success story. He passed all his exams. He did it, and he's a very hardworking person, and he's a very senior executive member as well, an ambassador as well. So hopefully at the end he will mention a few words as well about how we are here, all here to make your journey very successful and very pleasant. So over to you, Dr. Umar. I will stop now.
Thank you, Dr. Shakil. Thank you for your presentation and your very generous introduction. I'm just going to share my screen. Uh, s- yeah. Right. Okay. Okay. Dr. Shakil, please confirm that the screen is visible.
Yes, yeah, we could see.
Is it showing as a slideshow or is it
Oh no,
showing
it's
as
not. It's
okay.
not slideshow yet. Yeah,
Now?
yeah, that's fine. Yeah.
Okay, brilliant. All right. So what I'm going to do for everyone is obviously Dr. Skills covered the journey as a whole, the anxieties, the worries, the challenges and obstacles that people face in this journey. What I'm going to do is I'm just going to focus a little bit on the kind of details about the PLAB exams and just give you a quick summary because I'm sure everybody knows all about the exams, but just to make sure that you have all the information that you need. I'm going to speak a little bit about the PLAB exams, very short presentation, and then we will open the floor for questions. There's already one or two questions in the chat box, and then hopefully we'll be able to answer them for you. So PLAB is the licensing exam for international medical graduates who want to practice in the UK. It's set by the GMC, it's delivered by the GMC, and it's assessed by the GMC. The GMC is the General Medical Council who register, regulate, revalidate the doctors in the United Kingdom. So this is quite a complicated slide, which we just wanted to put up here to just show that PLAB isn't necessarily for everybody. But I'll summarize the slide for you very quickly. If you are a national of a country which is outside of the UK, outside of the European Economic Area, and outside of Switzerland, then most likely you will have to take the PLAB. So that means everywhere else around the world, Asia, Africa, Latin America, etc. Then the PLAB exam will be for you. And to work in the UK, you will need to sit the PLAB exam. I'll just mention here very, very briefly about the UKMLA, because there are still a lot of misconceptions about the UKMLA. Who is it for? What does it mean, etc. So essentially, the UKMLA is a licensing exam for UK medical graduates. Okay, so the two Pathways are still separate. They're still named separately. PLAB for international medical graduates, UKMLA for UK medical graduates, but the competencies are now the same. So the exam you take will be assessing the same competencies as the exam taken by a UK medical graduate. Because we've come across other publicity from other places, other companies talking about the PLAB exam and saying the name has changed to the UKMLA. The name hasn't changed to the UKMLA. The name is still PLAB for now. It might change in the future, but for now it's still PLAB, and the route is still separate. IMG is PLAB, UK graduate is UKMLA, but they are now both assessing the same things. Okay, so as Dr. Shakil mentioned in his presentation, the journey is made up of several steps. The first step is your English proficiency, and you have to prove this to the GMC before you can even attempt the PLAB 1 exam. So there are two options: IELTS, which has been around a lot longer, International English Language Test, and then the OET, which is the Occupational English Test, which we find, and our clients and candidates find, is slightly easier, more suited to a healthcare professional background. And the requirements are on the screen. So if you are doing the IELTS, you need a score of at least 7 in each testing area and an overall score of 7.5. And if you are doing OET, then you need a grade B in each of the testing areas, and the areas are speaking, listening, reading, writing. So that is the first step. Of course, there's a step that I haven't mentioned, which is your medical degree. You can't start the PLAB journey while you are a medical student. You have to get your medical degree first, and then you go to proving your English proficiency. Then after that, of course, we come to the PLAB exams. As you will know, there are two parts: PLAB 1 and PLAB 2. So PLAB 1 is what is a written exam. So it's not necessarily written on paper, but it's it's an exam that you have to actually read some questions and document your answers. It can be done on computer stations in most places. It can be done anywhere in most places around the world, and the GMC has test centers in the majority of the countries from where doctors come to the UK. What does PLAB 1 test? It's not just a test of your knowledge and your memorization and do you know the 55 causes of clubbing? It's not about that. The test is the ability that you have to apply your knowledge to the care of patients, and it covers common conditions, important conditions. So common conditions are conditions that occur commonly, you will see often if you're in the UK, and they are important in their own right because you will have to deal with them a lot. Then there are important conditions. These are conditions that are serious, life-threatening, or long-term serious illnesses. And then you have acute conditions. So someone presenting to the emergency department, someone presenting to a GP surgery, someone calling an ambulance, 999, etc. And in addition to this, it covers the management of long-term conditions which are seen in primary care. So these can be things like hypertension, asthma, diabetes, COPD, whatever chronic condition you can think of. Primary care was my specialty. So this is one of the reasons why I love teaching the PLAB 1 exam. So that's PLAB 1. PLAB 2 is a practical exam. It's an OSCE style exam. And this can only be done in the UK. And it is only sat in the GMC Centre in Manchester. We are based in Manchester as well. So that's very convenient for our candidates, that they can be trained in our academy, and just down the road, they can then go and sit their exam. So you'll all be familiar with OSCE style exams. You go around different stations, etc. All the questions are related to current best practice. So you need to be up to date on guidelines, evidence, etc. And this applies to PLAB 1 also. is that the medicine that you will be tested on, the protocols, procedures, etc., that you will have to demonstrate in these exams are for UK medical practice and not practice in your own country. So very briefly, the PLAB 1 exam, multiple choice question is actually a specific subcategory of multiple choice questions, which is called single best answer. 180 questions, 3 hours. So 180 questions, 180 minutes. Each question has a short scenario. Then the question is asked, and then you choose the single best answer out of the 5 options. Very straightforward, and I'm sure you will have done lots of these in your medical career. Very briefly, just going to mention our PLAB 1 premium package, which covers all of the material that you require to pass your PLAB 1 exams. There's video, audio, courses, 5,000 MCQs, 10 mock tests, and 200, it's actually not 200 digital flashcards, it's actually 250 digital flashcards. And you get access to myself, Dr. Shakil, at any time that you need. The PLAB 2 exam is 18 stations. It's not 18 scenarios, it's 18 stations. So 2 of them are rest stations, and each station lasts 8 minutes. And this is quite normal. You get this in GP exams as well. So this will be a very, as well as other specialties, this will be a very good preparation for any future specialty that you choose. It's 3 hours and 10 minutes in total. You get 90 seconds before each station to read the instructions and the patient information, have a think about what you're going to do, and then you go inside and then speak to the patient, examine the patient, or whatever else the scenario wants you to do. Our PLAB 2 premium package includes 10 days face-to-face training in the academy, Simman, mannequins, access to our PLAB 2 online video course, 2 mocks, over 1,000 flashcards, including clinical cases, explanations, nice CKS guidelines, etc. Lots and lots of stuff already there prepared for you, up to date with the latest guidelines. I just wanted to mention pass rates, not to scare anybody, but just to demonstrate that it is an exam. Number one, it's an exam that you can comfortably pass, but there are a few key ingredients to being able to pass it. Number one, you need the correct knowledge, that is UK-based knowledge. Number two, you need to be able to apply the knowledge. So it's not, as I mentioned, it's not just about memorization and who has the best memory, who can memorize Kumar and Clark back to front. It's not about that. It's about how you apply your knowledge to the question. And third, it depends on exam technique. You have to be able to manage 180 questions in 180 minutes. So if any 3 of these things are missing, then this will obviously quite significantly negatively impact your score. There's the last, we don't have the 2024 data yet, so there's the last 5 years of data available, and as you can see, PLAB 1 and PLAB 2, the pass rates vary between 62.9% to 74%. So that's, if you think about it, that's over 25 to 37, 38% of people who fail the exam. And I am confident that they fail because they are missing 1 or more of these 3 key things. And that is obviously what we are here for. That's what we're here to do. That's what we're here to coach you with and to help you pass comfortably. So the final thing I'm going to mention, because as I promised, it is going to be a short presentation. I didn't want to bore you with lots and lots of details, is what makes Hive different from everybody else. Obviously, no disrespect to our colleagues and friends in other academies. We have friends and colleagues in lots of them. they're doing great stuff, but what makes us different? There are a few points, and I wanted to highlight them. So the first thing is that we believe we are the most personal academy that you can join. So there are many stories. Dr. Shakil will be able to share them with you. I will be able to share them with you at another time, perhaps, about people who approached us for specific things. We had people saying, you know what, this online course, it doesn't suit me. What I need is I need face-to-face teaching for 1 month, for 1.5 months, or for 2 months for PLAB 1. So we did that. Somebody else approached saying, actually, I don't want to build this. I don't want this package because I don't need this and I don't need this in it. So we built them a custom package. So the experience you get with us will be about what you need for your journey, because everybody's different, and we appreciate that. The second thing is who we are. So Dr. Shakil, he's already told you that he's one of you guys. He's an international medical graduate. He's been through this journey himself. He's gone through the struggles. He understands everything that is necessary, and because of his experience, that makes us a better academy. On my side, obviously, I'm not an international medical graduate. I was trained in the UK. I was I grew up in the system in the UK, and then I became one of the examiners, one of the teachers, one of the tutors, supervisors in that system. So Dr. Shakil understands from the IMG perspective, as well as obviously having 2 decades of clinical experience in the UK. He understands the UK system as well. But on my side, having been that examiner, having been that person who who knows exactly what is being looked for, we cover both sides of the equation, and it's our stories, our experiences that drive what we do in the academy. We're always there. You will not find anybody else who, and we might have some current candidates who have already joined our academy, who are on the webinar today. They will verify that you really can get hold of us whenever you need something, and you won't get this anywhere else. We never stand still. We're constantly improving and updating our courses. I have a real bugbear about things being correct, about things being up to date. And so we're always constantly making changes. When the guidelines change, our courses change. When requirements change, when exam standards change, everything changes. We do what other people don't. So Dr. Shakil mentioned to you some specific challenges in the journey. Now, one of the biggest part of the journey that other companies and other academies don't really address properly is what happens after PLAB. There are issues during the PLAB journey as well, which get missed, which we cover, but also what happens after PLAB. In the other places, you pass your exams, they wish you good luck, and then you are on your own. Not here. We will be there with you when you apply for your first job. We will help you we'll help you improve your CV. We'll do mock interviews with you, and we will continue until that first job and beyond, and we'll continue through your career. We'll be there with you for advice, for as long as you need it. And the final thing is that we are uncompromising on our standards, and that's door to door. What that means is, from the day you join the academy, the experience you will have, the customer service you will feel, as well as the and I'm confident in saying the strength and the quality of our resources will be obvious. So as you can see, when I was putting this together, I just had a bit of fun with making an acronym of what makes us different. So we are your personal magic wands. If you want to move to the UK, you want to come and live and work in the UK and practice medicine in the UK, all you need to do is get in touch with us, wave the magic Hive wand, and you are on your way. So that is all I wanted to say about, just keeping it brief, the PLAB exams, what specifically we can do for you. And so what I'm going to do is I'm going to stop my screen sharing now, and I'm going to have a look, first of all, if there are any questions in the chat box, and then we will do them first. And then after that, we will open up to the floor if anybody has anything else to ask. So Dr. Shakil, I believe you're having some technical issues, but you can still hear us. Is that correct? Okay, that's fine. So let me tackle this, ask this first question, Dr. Shakil. I think this question is most appropriate for yourself. So I'll ask it, and then if you can answer, then please go ahead and do so. So how many years, Altaf, thank you, Altaf, for asking your question. How many years of gap after graduation makes someone ineligible for the PLAB exam? And the second part of the question is there any number of attempts or age limit for applying? Dr. Shakil, can you hear us? Please unmute yourself and speak if you can. It doesn't matter if you can't come on screen. If you can hear us, you heard the question, please come on and answer it. How many years of gap after graduation makes someone ineligible for the PLAB exams? And is there any number of attempts or age limit for applying? Okay, I think Dr. Shakil might be having some issues, so I will attempt to tackle this as best as I can. So how many years of gap after graduation makes someone ineligible for the PLAB exam? There is no specific ineligibility based on any gap that you might have, but what's important is that you are able to fill that gap for the GMC with either some explanation about what you were doing within that period. How were you keeping yourself up to date? How were you keeping your skills up to date and your knowledge up to date? And that is what Hive is here for, and that is what Hive will help you do. We've done this before for many candidates, and so we will help you through that. Is there any number of attempts or age limit for applying? So again, I hope Dr. Shakil can correct me if I'm wrong. I think there is there's no age limit. That's the first thing. Okay. So whether you are 23 and just graduated, or 65 and almost about to retire, or any age in between, as long as you meet the eligibility criteria of medical degree, you can prove your English competency, you pass your PLAB 1, you pass your PLAB 2, you can sit the PLAB, and you can move, you can register with the GMC, and you can move to the UK. Dr. Shakil, good to have you back. Could you just clarify, is there any number of attempts on for sitting the PLAB exams?
Thank you so much. And really sorry, my screen was gone blank. So I
No
could hear
issues.
you, but I could not unmute myself. So I am back here. First, there's any career gap doesn't matter as far as it is reviewed by the specialist, by the consultants. We need to put things on the CV. We need to adjust your CV. Doesn't matter. PLAB 1 exam, there are 4 attempts in a year. Every year it's 4 times you have to take. And after 4 attempts, if you could not pass it, then you need to request a GMC to give you permission to apply again. But majority of doctors, they pass in first attempt or second attempt. But most of the doctors, they pass in first attempt. As far as they have got proper guidance, they have got proper resources, there won't be any issue. Age limit, there was another question because I could hear it. There's no age limit. Either you're fresh graduates, either you are 65 years old or 70 years old. No, I have seen the doctors. who was 70 years old and they did the PLAB and they're working as a locum consultant. So there's no age limit. PLAB 2 exam, again, the GMC, they're taking very frequently, almost every day. So there's no issue because there's a huge demand, huge shortage of the doctors. So they're taking PLAB 2 every day. And PLAB 1 is 4 times a year, every February, then May, then August, and then November.
Next question is, I have been doing 1 year internship back home post grad and thinking about doing the PLAB. Where to go from there?
That's a very good question. And just live with us, just contact us. Either you want to go on our website, just register from the website. And first, we will take your hand and we'll take from there. I think this is the best time because you are just a fresh graduate and you will be able to apply for foundation program. And if you want to go to GP or consultant training route, you'll be consultant soon. So just register with us, start preparing for your OET and then for the PLAB exam. So start both together. That will save you time. I would say if you want to start now, keep your target for your PLAB 1 exam for the May 1. So OET classes our started like yesterday, day before yesterday, our OET batch started. So you can start your OET and then same time start PLAB 1 premium package and we'll take things from there.
Two more questions. First one is, at what stage of the exam we are eligible to apply for a job?
For if you're talking about the PLAB journey exam,
Yeah, I
in
think
the
it
U
means when can we
uh,
apply for a job? Yeah.
yeah. So in the UK, unless you have got the GMC registration, you can't work as a doctor. So you need to pass your exams. So how we schedule things for our candidates, what we do, we give them proper schedule. These are the days you need to do PLAB 1, OET, PLAB 1, PLAB 2. After PLAB 2, once they have taken PLAB 2 exam, there are 2 weeks for the waiting time for the results. So during these 2 weeks, what we do, we arrange their clinical attachment. That gives them a time to understand the system, manage system. That's the NHF's induction. They get the local references. And we also review their CV. We do their mock interview. We create the job profile. So they are ready for the job. Once they get the GMC registration, we help them to submit the GMC registration application, reviewing the gaps and all professional analysis. They get registration within 24 to 48 hours. And after that, they are ready to apply for the jobs and interview. Everything is ready, they get it. So you can't work as a doctor before you have GMC registration. So because PLAB 2 visa will be your visit visa. That's for 6 months. Hope that answers the question.
Final question is, in the chat box at least, how do we become GP after clearance of foundation years?
Right. For the GP, as I mentioned, the two training systems. Foundation, which is called in different countries PG training. That after MBBS, what's the PG training route in the UK? So I tell you, the training after MBBS, after foundation program, you will have two options. If you want to become a GP or you want to become a hospital consultant. For the GP, you will apply for the GP ST training, GP specialty training. That training is 3 years. 2 years will be the hospital rotation, different specialties, either 4 months rotation or 6 months rotation. And 1 year you will be spending in the GP practice, GP surgery, where you will have education supervisor, clinical supervisor, and they will supervise you. During this 3 year time period, you have to pass two exams. MRCGP Part 1, which is called AKT, which is most likely sort of similar to the PLAB 1, but slightly different, but similar to the PLAB 1. And then you have got the second part, which is more like OSCE type, which is the CSA or SCA. So these two exams you have to pass, and then you'll get MRCGP, and then you become independent general practitioner in the UK. So shorter training, 3 years, you become a GP. But if you want to become a consultant, 5 to 7 year training in hospital. And one more thing which I should highlight, your every training, every single training is fully paid. None of your training is unpaid in the UK. All your training, GP training or specialty training will be paid. When you start your SHO or foundation program, your starting pay is gone recently up, is around 36,000. But if you do extra hours during the day, you will get the good amount of money per hour as well. Once you become a registrar, your starting pay will go up around 50 to 70,000. When you become consultant, it's 100,000 plus. So nothing is unpaid. There is no free. Nobody will ask you to work for free. So everything will be paid. And you think in a way, whatever you will invest to prepare, to get the resources, to get your dreams true, you will earn back within just few months. Oh, I hope that answers. Yes,
Yeah, thank you. I think that's okay. Another question. What can we do to build our CV stronger in our home country?
fine. I would say once you start your PLAB journey, we will guide you. Before that, I think whatever you do in different countries, it's not going to matter in UK because it's a different training system, different culture, different requirements. There are certain CBD courses which we have designed specially for international medical graduates, which are like GMC appraisal, GMC registration, clinical audit, clinical governance, how you speak to patient, how you discuss the case with the senior consultant, how you refer a patient. So if you look at our website, we have specifically shortlisted and designed some CBD courses which could help you. So while you are preparing for your PLAB 1 exam, or either you are preparing for your PLAB 2 exam in your country and waiting for your visa application or waiting for other things, you can complete these CBD courses because these are the UK CBD courses and you can put these on your CV and they will make you stand out when you go for the interview. And once you are with us, once you register, you're preparing obviously for the post-PLAB services, we will provide you several CBD resources which you could do more CBD courses to build up your CV.
Okay, thank you. I think there's not any other questions in the chat box. You're welcome, Altaf. I just wanted to give anyone else who is in the webinar one final opportunity to ask something if they want to. Please just feel free to either raise a hand or unmute yourself and just speak. As otherwise, we will then conclude the webinar if there are no other questions. We've posted a message in the chat box. Our website is there. Our contact details are there. On social media, obviously, you can contact us through them also, as well as contact numbers. So please, if there are any other questions, okay, Ijaz has a question. Please unmute yourself and ask away.
And I think we will have few minutes for Dr. Parvaz, our senior ambassador. He is waiting to say a few words to these new doctors.
Sure. Ijaz, you have to unmute yourself. You've put your hand up. I think hopefully not accidentally. Okay, while we're waiting for Dr. Ijaz, Yasin has asked OET or IELTS. I think we answered that already, but Dr. Shakil, do you want to say anything else?
I think OET is a majority of doctors and nurses they prefer to do OET because they find it easy. OET is more related to your consultation, doctor practice. So I would say OET is far better than IELTS. And we will help you if you are interested. As I said, if throughout this journey, whatever you need, we will help you. You just focus on your exams, carry on with your job. We will give you the strategy and plan to prepare this journey and these exams according to your lifestyle, whatever you're doing at the moment.
Okay. So, Dr. Ijaz, if you want to try to unmute yourself, please do. Otherwise, just type it in the chat box. And in the meantime, I think, Dr. Shakil, do you want to hand over to Dr. Parvaz to say maybe a minute or so just to say something?
Yeah, so I'm going to hand over to Dr. Muhammad Yunus Parvaz. He's a senior ENT surgeon, an international medical graduate, and executive member and ambassador of Hive Medical Academy. Dr. Parvaz, over to you. If you want to say a few words about this new coming, please unmute yourself and then, yeah. Please unmute yourself. You're
muted,
Dr. Parvaz.
Dr. Parvaz.
Yeah, that's fine now. Yeah.
Thank you very much, Dr. Shakil Malik and Dr. Umar Farooq for your nice demonstration today. Being an ambassador of Hive Medical Academy, that shows my passion to help those doctors who are interested to come in NHS. In my career, I have found many of the difficulties, but now HS is here to provide you a platform and to give you an opportunity where you can build up your career, you can progress in future, you can fulfill your potential. And it's a great ambition to be a part of NHS or working abroad in other countries like in America, Australia, Canada, or in Europe. So Hive Medical Academy is a really a good platform for you that offers you to please join and just take your opportunity and go ahead for your future. Best of luck.
Thank you so much, Dr. Prabhas. That's very kind of you and a very good message for all the international medical graduates. And we just want to reassure everybody that we are here for you guys. Whenever you want to plan your journey for the PLAB, for the better training and better future, just give us a shout. If anybody else has got any questions, otherwise we're going to end the meeting, and we will have more frequently webinars coming every month. We have got 2 webinars. So keep an eye on our website and lots of resources there. Just register for upcoming webinars. And if you get any question later on, just drop us a text or just email us. Thank you so much. And thank you so much, Dr. Umar. Thank you so much, Asma. Thank you so much for the rest of our team for putting your efforts on Saturday and making it very successful. And we'll see you soon again. Thank you so much.
Thank you, Dr. Shakil.
Thank
Thank
you.
you. Have a good weekend,
Thank
everyone.
you very much and goodbye.
Thank you.